This episode of PediaCast is brought to you by the music therapy program at Nationwide Children's Hospital. Hello, everyone, and welcome once again to PediaCast. We are a pediatric podcast for moms and dads. This is Dr. Mike coming to you from the campus of Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 590. We're calling this one Healing with Harmony, Music Therapy in the NICU. I want to welcome all of you to the program. So music is powerful. It can calm, soothe, and even heal. And for premature and other newborns in the Neonatal Intensive Care Unit, music therapy is making a difference in surprising and meaningful ways. Today, we're going to explore how board-certified music therapists support babies and families in the NICU, from easing pain during procedures to strengthening bonds through live music, recordings, and developmental programs. We'll also share how families can use music at home to comfort and support their children, and also to support their own lives and their own mental health. So we're going to talk about all of these things from the NICU to the home and beyond. Of course, in our usual PediaCast fashion, we have a terrific panel of guests joining us in the studio to discuss the topic. Kalin Moran, Lelia Emery, and Chloe Heintz are all music therapists at Nationwide Children's Hospital. They'll join us soon, so stick around as we uncover the healing role of music therapy in the Neonatal Intensive Care Unit. Before we dive in, I do want to remind you the information presented in every episode of our podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you're concerned about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get our experts settled into the studio, and then we will be back to talk about music therapy in the Neonatal Intensive Care Unit. It's coming up right after this. Kalin Moran, Lelia Emery, and Chloe Heintz are all board-certified and licensed professional music therapists at Nationwide Children's Hospital. They have a passion for supporting premature babies and other infants along with their families in the Neonatal Intensive Care Unit at Nationwide Children's. So what exactly is music therapy and how does it support infants and families? And is music therapy something parents can do at home? We'll have answer to all of these questions and more, but first let's pause and offer a warm PediaCast welcome to our guests. Kalin Moran, Lelia Emery, and Chloe Heintz, thank you all for stopping by the studio today.
Thank you so much for having us.
Yeah, we're happy to be here.
Excited to be on.
Yeah, I'm really excited to talk about music therapy as well. Kalin, let's start with you. What exactly is music therapy and how is it different than simply listening to music?
It's a great question. So there's a formal definition by the American Music Therapy Association that states music therapy is the clinical and evidence-based use of music intervention to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. I know that's very wordy, so a shortened version is music therapy is the use of music to accomplish non-musical goals.
Yeah, and then how did this get started? How did we discover that music can be therapeutic and that there are best practices for using it?
The concept of music being used therapeutically dates back all the way to the writings of Aristotle and Plato. But music therapy as a profession really began in the 20th century after World War I and World War II. There were community musicians who would go in and play at veterans' hospitals. And there were notable physical and emotional responses, which then led nurses and doctors to request hiring musicians by the hospitals. And then the demand grew for a college curriculum and just became evident further that training was needed prior to these musicians entering the facility.
Yeah, really interesting, and it sure makes sense. Leela, how does one then become a music therapist? And I'll ask you personally, like, how did you get interested in this field? And then what does someone have to do if they are also interested in pursuing this?
Sure. I'll start with the how did I get interested in music therapy part. I actually had cancer as a child, and so I grew up with a lot of friends also going through cancer treatment and really learned about music therapy through them and how it supported them in the hospital or through grief counseling after the fact. And I'd always loved music, and that's kind of where I was able to align my two passions. So that was really awesome. As far as training to become a music therapist, so like Kalin mentioned, there is a college curriculum. We have a bachelor's degree in music therapy at the minimum. And what that entails is 4.5 years of undergraduate study, taking classes from everything from psychology to music specific courses. So, music theory, we have like a primary instrument that we study, but also music therapy specific courses on different ways to use music therapeutically with different types of people in different areas. It also involves hands on practicum placements. So, actually doing music therapy under direct supervision. The last step of training is a 6-month full time internship. We are actually an internship site here at Children's, and we have 2 interns who just started at the beginning of September, which is pretty exciting. And then after you complete all of your training, you have to sit for a board exam. So students who are interested in pursuing that should really just Google music therapy programs. Our Music Therapy Association, AMTA, at musictherapy.org has a list of all the approved training sites in the country.
Yeah, that is really, really fascinating. The NICU in particular is certainly a specialized environment. Is there particular training that you need to work in the NICU, or is it just sort of on the job training? How did you get placed there?
Yeah, so there is definitely additional training to work in a NICU. I was lucky enough that I got to receive this training as part of my undergraduate curriculum. One of my professors was a fellow in the institute, so she trained people. I'm actually now a fellow in the institute as well. So I get to provide hands-on training. But to get your NICU specific training, it involves lecture, reading, hands-on training with a fellow, and then an additional exam after that to make sure that you are competent in being able to support this very fragile population.
Yeah, yeah. Chloe, premature babies undergo a lot of stressful procedures, and someone who has not spent much time in a NICU may not be aware of that, but there are a lot of stressful things going on. It tends to be, even though we try to keep it quiet, it still tends to be sort of a stimulating, noisy environment because there's so many other babies in close proximity. There's always something going on, and sometimes that does involve painful procedures as well, like putting in IVs and doing a spinal tap or what we call lumbar puncture. They may need to be on a ventilator. Just lots of stuff going on. Is music therapy something that you use to reduce that kind of stress, or is it more for the parents there in the room?
Yeah, music therapy can definitely be used to support infant stress as well as support parents that are in the room. So, like you said, our babies in the NICU, they undergo many stressful procedures, whether it is like IV placements, lab draws, or even just changing their diaper can be really stressful for some of our babies. So, we use music to help meet babies where they are, typically using singing. Sometimes, if they're older, we might throw in an instrument. If families are there, we encourage them to sing to their baby as well. And we change the music based on infant response to kind of support them going from maybe an overstimulated, agitated state to a calm state. So, yeah, we support many procedures and help reduce infant stress that way. And also, not only for the infants and parents, but our medical team has also reported that they find music therapy in the room to be helpful for them when typically if they have to do this procedure and the baby's crying, like they just have to do their job, but having that added support can be helpful to them as well.
Yeah, so really everybody benefits, right? And I'm sure you benefit as well because it's something that you're passionate about and that you love doing. And I'm sure when you get that response, especially from the baby, when they start to calm down and you can tell that they're listening, That must be really, really rewarding work.
Oh, yeah, it definitely is. When you see that immediate response, it's pretty cool.
Yeah. Is there ongoing research in this field? We're always trying to find the best way to do things. And, is there a better way, something more efficient? Is there research happening in music therapy and particularly in healthcare settings and in NICUs?
Yeah, there is just a wide array of research in pediatrics and healthcare and music therapy, also in the adult world. That could be a whole nother podcast. And then in the NICU in particular, there is lots of research going on as well. We've actually done quite a few studies here. And we just did over the past year or two, I don't know, we did a study looking at music therapy during a painful procedure. So during circumcision, actually, in particular. And there's always more research that needs to be done. There's actually not a whole lot of research in procedural support in the NICU specifically, but that is starting to change. And so, yeah, we're always trying to find what's the right type of music therapy, dosage, timing, and stuff so that we're doing best practice in the NICU.
Yeah. Just like anything, and I love that you said dosage and timing,
Mhm.
because, everything that we do, every intervention has, benefits, but then may also have things that aren't so great. And I can imagine that if you have a baby who's already overstimulated, like you might find that right music
Mhm.
and maybe they just want quiet. And
Yeah.
so you just have to sort of judge, what is working in the moment. And that's going to be a lot different from one baby to another. There's no one size fits all, I would imagine.
Yeah, you got that exactly right. So,
Yeah, and then how do you involve families in all of this? I imagine that it's not something that a lot of people have been exposed to, and certainly you don't see it, when you see medical shows on TV, for example. So the things that the public typically has experience in terms of healthcare settings. So I imagine there's a lot of interest, and folks, would want to get involved as best they can, and maybe even understand how they can do the same sort of thing home to continue that once they're discharged. So how do you get families involved?
mhm. Incorporating the family into our care is really an important aspect of our work. So we acknowledge that for families, being in the NICU is a really stressful time. And we know that babies respond really well to caregiver voices. That's what's familiar to them. And so we do encourage and educate parents on the proper uses, music, encourage them to sing, or if they're not comfortable singing, like talk to their baby. It really is so helpful for not only comfort, but language development. And so we provide that education and support and encourage them that, to them, they sound like Beyonce to their baby, and they don't have to be a professional singer to use their voice and to sing to them and comfort them. And so we also provide family support and opportunities for family bonding by playing songs that are important to the family. So using that preferred music genre of the family. And we can also do songwriting as well. So helping families to create a lullaby for their baby that's unique and special to them is a really special opportunity that we can take part in with our families on the NICU.
Yeah, absolutely. Chloe, so this is, of course, live music that we're talking about. With recorded music, is that something that can be as beneficial? There may be facilities that don't have access to music therapists. Is that something that folks could just listen to music, or is the live aspect of it really important?
Yeah, that's a great question. And that's something that a lot of healthcare professionals are really interested in is how can we be using recorded music in a helpful way in the NICU? We as music therapists obviously love our live music. We think that's really important, especially in the NICU setting where our infants are fragile and we really have to be reading into their cues and we can change what we're doing live in the moment. Whereas when you play a recording, you hit play and then that's that. All you can do is stop it if an infant has maybe an adverse reaction to that. But that being said, we do encourage parent recordings through our program here. We have a program called Sounds of Love, which maybe I'm getting ahead of myself. But parent voice at the bedside is super important. Like Kalin was saying, we really want our families to stay connected with their infant, even when they can't be at the bedside 24/7. And that parent voice is so important for our babies to hear that we coach parents through how they can be using their voice through a recording. We also have instructions for bedside nurses and anyone who might be playing these recordings for when to play them, when maybe is not a great time to play them and allowing for breaks in between. So
Yeah, and I would imagine as a music therapist in the healthcare setting, you're really just focused on the music and its impact on the child and the family. Whereas if you put a recording on as a nurse and you've got, three patients all together and you're running from one place to another and alarms are going off and people are asking you questions, if the music is irritating to the baby, you may not notice that right away. And
yeah.
so at least with the live person doing the music right there, you're really focused in on the patient and the family and seeing that reaction and making instantaneous changes, when something's not working, in order to maybe try something out that's
Mhm.
different. And you can do that on the fly. So that's really a cool service. Tell me a little bit more about the Sounds of Love again.
Yeah, so it's our parent recording program. So, like Kalin said, we try to get our families as involved as possible in multiple ways. But as music therapists, we want to encourage their use of their voice at the bedside, whether that is singing, which of course we love, or if it's just talking to their baby or reading stories, poems. Some parents like to read prayers, and we can work with them to record their voice and then put it on a speaker so that babies can hear them maybe overnight when they're awake and parents aren't there, or if parents go back to work. There are numerous reasons why parents might not be at the bedside. And something else that we can do is encourage sibling or extended family involvement too. So lots of grandparents likes to get in on this. We get lots of fun sibling recordings that we edit and make sure they're quiet enough for these teeny babies to hear. We've also gotten like aunts, uncles, and cousins and stuff too. So it's a great way for family to feel connected and supportive of this baby that's in the NICU for any length of time.
Yeah, yeah. Kaylin, what are heartbeat recordings and how do you guys use those?
Heartbeat recordings are a really cool intervention we offer often for legacy making for patients nearing end of life and also for patients celebrating milestones, maybe a 6 month, 1 year, their due date milestones such as those. And the way it works is we have a stethoscope with a microphone on it. So we record the infant's heartbeats. We come back and edit it on our software to take out any background noise. And then we can offer to family to pair a song with the heartbeat. And so then the heartbeat kind of becomes like the drum beat, the backbeat of the song. And it can be a really special memory item to have. And families can keep that and continue to listen back to their baby's heartbeat recording for the rest of their lives.
Yeah, yeah, that is a really cool. Now, Leela, some babies in the NICU are just there for a few days, and then others are there for a really long time, and especially those very premature babies who have a lot of feeding and growing to do. Does music therapy change depending on the sort of stay that a patient has, and in particular, the length of time that they're there?
Yes, absolutely. So, like Chloe mentioned earlier, live singing is very slow, steady, quiet for our preterm infants. As they do get older, we're able to incorporate different types of music, different instruments to really support their overall development. In our NICU, especially, our entire therapy team takes a very proactive approach to supporting these babies, and we try to make things as typical as possible for our families. So, if you think about like a baby who gets to go home right after they're born. They're often held and sung to and talked to like constantly, even sometimes subconsciously, like parents don't even realize it. There's like the joke about the mom, like how to spot a mom in the wild, and she's just kind of swaying in line at the grocery store, not actually holding a baby. So obviously, when they're in the NICU, this very abnormal clinical environment, they don't get those natural opportunities. So we have to create them. So getting them out of bed to hold them whenever they are medically ready for that sort of stimulation. As they do get older and start to have better brain development, we can like increase the different types of like speeds and tempos of music we do. We can bring in more parent preferred music. We have lots of small baby sized instruments to incorporate different sounds. Like if you think about a baby who's at home, they might hear the dog next door barking or, the laundry, like all these things that we don't necessarily think about being different and special, we can kind of bring into the NICU in different ways. And like Kaylin mentioned, milestones are really important. So we document those milestones too, whether it's with a heartbeat recording or just taking pictures of the baby for their parents the first time they hold a shaker. All of these can be really important to supporting the overall family when their baby is in the NICU for 6, 12, 15 months.
Yeah. And then how can parents continue this at home? I'm sure that there's a lot of folks who, once they're exposed to it and they see the benefits, think, well, I don't want to give this up when I
Mhm.
have to leave the hospital. What can parents do at home to keep the music therapy going?
Yeah, absolutely. So we like to give parents some discharge info on different ways to use music because there's so many opportunities to engage with their little one in a like non-threatening, fun way. So using music to support speech goals, whether that is through incorporating a lot of like vowel songs, like if all the raindrops, the chorus is just ah. And that's really encouraging for babies to kind of repeat that back. Using movement songs to encourage babies to clap their hands or even just swaying to the beat. All of these things can help support overall development. Even using rhythmic support when reading can lead to better reading outcomes later in life. And then we're actually really lucky that we get to offer outpatient groups for our families in the Columbus area. For those who are farther away, and we try to provide them with resources. We have a little like recorded music, like Beyond Miss Rachel, that we give to families too, just so they know like all the different opportunities there are for them to follow along with someone who has made early childhood music like their passion and their goal. That way they don't have to reinvent the wheel because it can be really overwhelming to discharge from the hospital.
Yeah, yeah, absolutely. Chloe, tell us a little bit more about the outpatient programs that you guys do, and one in particular called Giggle and Groove, which I love that name, by the way. What exactly is Giggle and Groove, and how does that support these youngsters who have graduated from the NICU?
Yeah, so Giggle and Groove is our music therapy class for caregivers and infants, toddlers to just support developmental milestones after they leave the NICU or even just support our community members at large. So, one of the ways that we do support our NICU graduates through this program is that the class is free to all our NICU and cardiac graduates from nationwide. And then community members can join for only $5, which is a steal these days. And we just work on different things like following directions, bonding, listening, different movement activities, grasping, reaching, you name it, we do it in that class. And we actually have expanded to 2 locations at this point. We have a group at the Westerville close to home and the East Columbus close to home. And we support infants 6 months corrected to 2 years. So it's been a lot of fun.
Yeah, and it's really great, I'm sure, from your point of view too, that you can actually follow some of these kids after they go home because especially the ones that have been in the NICU for a long period of time, there are attachments that are made between the clinicians and the baby and with the family. And you really all start to feel like a family, and then all of a sudden they're gone.
Mhm.
And so this does provide some continuity for you guys, and I'm sure that's also helpful for the family too, especially since you're providing a service that really is comfort oriented. I'm sure it's great from their point of view to see you guys again too after they go home. Do you find those relationships continue in that way after folks leave the NICU?
Oh, yeah, for sure. It's really fun to see the babies we've worked with out in the wild, so to speak, whether that's in a Giggle and Groove class or even just when they come back for follow-up appointments and you see them in the hallway and you get to chat about how much they've grown and now they're singing these songs that you did with them in the NICU. So that's been really special for sure.
Yeah, yeah. And then what about parents and families just in terms of music as something that we can also use, especially during stressful periods? How can we use music therapy in our own lives? And Kalin, how do you use it in your life?
Music can be incredibly therapeutic. So families can definitely use concepts and ideas from music therapy. Of course, music therapy involves the trained professional, but there are principles such as the ISO principle, which is all about meeting someone where they're at musically. So if you're in a really anxious state, you might want to find a song that kind of matches that feeling and can help to regulate your own emotions. So choosing a song with a quicker tempo, or if you're find yourself feeling kind of down or grieving, finding a song that matches that mood. Maybe it's in more of a minor key and then slowly changing the music over time to bring you to that desired state. If you find yourself feeling in that sad, grieving state and you want to feel more hopeful, you can even kind of put together a playlist of like, okay, here's my super sad, dark song. Here's my slightly less, it's a little quicker tempo. Okay, we've changed to a major key. And then by the end of that playlist, we're bopping around to a really upbeat, fun pop song. So I find music to be incredibly supportive, not only of my emotions, but also helping with motivation. So completing tasks, like I'll put it on when I'm trying to clean at home. It makes it a little bit more enjoyable, and kind of finding playlists or designing playlists to help kind of bring me to a more desirable state. So there's a lot of wonderful ways that music can really help decrease cortisol, decrease the stress levels that you're experiencing to help you find joy and relaxation.
Yeah, and that makes so much sense. And I'm sure that there's folks who I'm hoping that there's a lot in the audience who are having an aha moment right now that I can see where that would work. And when you are maybe in a sad mood and then resting in that sadness and listening to sort of melancholy music, but then have that playlist gradually take you to a higher level and to, a more energetic, upbeat soundtrack that then can also go along with your mood. I love that, and I think I need to try that myself.
Yeah, music can be incredibly validating. It helps us to feel supported, like we're not alone in that feeling.
Yeah, absolutely. Leela, I'm sure music therapy extends outside of the NICU at our hospital. Where are some other places where music therapy happens? And just tell us more about the program in general at Nationwide Children's Hospital.
Yes, it absolutely expands past the NICU. We actually have the largest pediatric team in the entire country with 15 music therapists. Those music therapists are in all inpatient areas of the hospital, so every floor of our main tower building, including hematology, oncology, the pulmonary unit, etc., you name it. We also have music therapy in our in-home hospice and palliative care teams. We have 3 wonderful therapists out there, and we have 1 music therapist in our behavioral health pavilion. We do offer a couple outpatient experiences too with our outpatient pain program, our Giggle and Groove groups, which we mentioned, dialysis, the infusion clinic, you name it. And we're really trying to expand even more just to provide as many people as possible with the really beneficial music therapy experience. It's pretty awesome. I've been here for 12 years now in October, and the way music therapy has grown at this hospital is really incredible. I can't wait to see what we do next because the team's really awesome.
Yeah, and we'll put a link in the show notes over at PediaCast.org. It's episode 590, and we'll put a link to the music therapy program at Nationwide Children's Hospital. We'll also have a lot of other links for you, so be sure to check those out, including upcoming events for Giggle and Groove. So as was mentioned, for $5, you can join in on the fun, especially if you have a little one at home that would benefit from giggling and grooving, and I think we all could benefit from that. So we'll have a link to the upcoming events on the website. Also, an interesting program at Florida State is a NICU Music Therapy Institute. And so if you are interested in learning more, we have folks, of course, in the audience from all over the country, not just here in Central Ohio. And so we do try to spotlight other services and places where you can learn more. And the NICU Music Therapy Institute is a good one, again, in Florida State. We also have music therapy helping kids heal and learn. It's a 700 children's blog post that Leela did. And Leela, you're the content creator of the group, I think, because there's also a virtual music therapy with Leela on YouTube. And so we'll put a link to that. Music for Kiddos is a great YouTube channel. And then we do have some more information if you're interested in becoming a music therapist. The certification board for that profession has lots more information, and we'll put a link to that in the show notes as well. So again, check those out over at PediaCast.org for episode 590. So once again, Kalin Moran, Lelia Emery, and Chloe Heintz, thank you all so much for stopping by and chatting with us today.
Of course. It was an honor to be with you.
Yeah, thanks for having us.
Thanks, Dr. Mike.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks again to our guests this week, Kalin Moran, Lelia Emery, and Chloe Heintz, all music therapists at Nationwide Children's Hospital. Don't forget, you can find our podcast wherever podcasts are found. We're in the Apple Podcast app, Spotify, iHeartRadio, Amazon Music, Audible, YouTube, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, like literally all 590 of them, and show notes for each of the episodes, also our terms of use agreement, and a handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show, and we love connecting with you on social media. You'll find us on Facebook, Instagram, Threads, LinkedIn, X, and Blue Sky. Simply search for PediaCast. Also, be sure to check out PediaCast CME, especially if you're a healthcare provider. It is similar to this program. We do turn the science up a couple of notches, and we offer free Category 1 CME and CE. So that's continuing medical education credit for those who listen. And that does include physicians, but also nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And it's because Nationwide Children's is jointly accredited by all of those professional organizations that we can offer the exact credits you need to fulfill your state's continuing medical education requirements. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. We also have a faculty development podcast from the Center for Faculty Advancement, Mentoring, and Engagement at The Ohio State University College of Medicine. It's called FameCast. So if you're a teacher in academic medicine or a faculty member really in any of the health sciences, then this is a podcast for you. And you can find FameCast at famecast.org and wherever podcasts are found by searching for FameCast. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.